Hello everyone, this is Bob Browner with update number 11. Today we're going to take a deeper dive into the numbers because we haven't done that for a while, and then use that to kind of explain whether we really can open again and how long it's going to be. So, if you've been following numbers, the United States now has both the most deaths and most cases. We hope we weren't going to be in this situation, but we are. It doesn't necessarily mean we have the most severe because we're a much bigger country than some of the other countries, but still it's much worse than what we hope to be at this point. If you look at the country by country, it's helpful to look and realize that yes, we have more deaths than Italy, but we're also more than 5 times the size of Italy, so it isn't exactly an apples to apples comparison. A couple other things I think that jump out to me as far as these numbers is this case fatality rate here. And so keep in mind that the case fatality rate is not 10 or 12% like some of these countries. What's happening in these countries is they unfortunately were caught very flat-footed with testing. They're not testing hardly at all anymore. They're focusing on taking care of the people they can just to make sure people don't die. So they've really kind of given up on doing a mass job of testing. They're doing some testing, of course, but nowhere near enough because they can't. And so the case fatality rate isn't 12.7% United Kingdom. It's probably in that couple percent range. We really don't know because we don't know how many cases are being they really have, although it's probably quite a few. U.S. and China, we're kind of in the middle of the pack. We're not as bad as them as far as our testing. We're not as good as the gold standard, which I would say is Germany and South Korea. Two concerning things to me about Germany and South Korea, though, is their case fatality rate, even with their extensive testing, is over 2% now. I think again they're not necessarily catching all the cases, but the other issue we're having with coronavirus is unlike the influenza epidemic of 1918, where deaths happen in a couple days. The deaths due to coronavirus take place over 2 to 3 weeks, which is again why there's been I think so much lag to realize what was going on, because by the time it hits you, it's going to be a couple of weeks before you see all those deaths. And so the case fatality rate may be a little worse than we thought it was, which is the downside. The other thing is if you assume let's say for example, the case fatality rate is 1%, well then you can kind of back into how many cases they probably really do have. So if you have 100 cases for every one death, then the real number of cases in the United States probably is over 2.2 million, which is about, still not over 1% of the population. However, if you look at Italy and Spain, they may have 3 to 4% of their population that's already been infected and then some, and it may still be growing a little bit depending on how good a job they've done with social distancing. If you use a 0.5% case fatality rate, it actually means it means maybe it's not as severe, but also means the number of people infected is much higher though as well. So I think what we can glean from this is it's pretty much worldwide, and we're seeing who's doing the best, who's doing the worst, and who's kind of middle of the pack. And it looks like we're kind of middle of the pack basically. So it could be worse, but we could be a lot better too. The other thing, though, I wish I had better news about this, but I think some of the initial data saying Nebraska was better was wrong, and here's why. So there's this Johns Hopkins site which looks at the total number of cases, but that's not a fair comparison. You really should have it normalized by population. When we go to normalize Nebraska by population, something funny happens to the graphs. We jump all the way out to here, and what happens is instead of us being on day number 26 from our index case, this is misidentifying us as farther on, because I think this is including all those cruise ship passengers that were at the UNMC isolation center. So it's misjudging where we really are. We're really an break day number 26, which means you just slide this number all the way back over to here, which means we're actually really in the middle of the pack as far as other states. So some people I think thought Nebraska was in the clear and we've done a good job. That's not true because this data is wrong. The other thing is our per capita testing rate is one of the lowest in the country. So we actually could be up here just because we don't have as much testing. So we're not as good as we thought we were, unfortunately. I wish I had better news than that. The other thing is looking at our own data has some concerns as well. We have a couple hot spots, and this number where it only shades based on absolute numbers is also a little bit misleading. Again, you have to normalize by population size, and this site doesn't do that for us. So really we need to not just look at this. I do think Grand Island and Adams and Hastings are hot spots, and I'll explain here in just a second why. Essentially, if you look at the number of positive cases over here, and then look at the percent of the population that is positive, you'll see that the positive population that's positive is much higher in Grand Island, 0.26%, which isn't that far off of New York and much above national averages. So here in Lincoln, we may have done a good enough job, I hope, but again, our testing rate is really low. So over here is the percentage of the population that's actually been tested. In Lincoln-Lancaster County, we have the lowest testing rate across Nebraska and much lower than U.S. averages. So our low numbers could be a fact that we just haven't tested as much. In Hall County and Grand Island, which is a hot spot, we still don't have that many people tested. They're barely up to U.S. averages, much farther beyond New York. I'm very concerned that Hall and Grand County have a lot higher numbers than that, and I've talked to some of the physicians locations in Grand Island. They think a lot of folks have gone untested. They're basically just presuming people are positive because they don't have enough testing supplies. Hull County or Adams County, Hastings to the south of them also shows a very high positive test rate, meaning when they test 23 or 31% of the time that test is positive. So they're being very restrictive about the testing they have because they just don't have enough. And the percentage of the population that's positive is either above the U.S. averages or not starting to approach New York potentially. So we do have our hot spots in here. The other thing is, again, by backtracking, or like the other slide, if you look at the case, if you assume case fatality rate is 1%, if you have 17 people positive, that means you probably have at least 1,700 cases in Nebraska, not 814. And if you're misidentifying or undercatching by even more, we could have 3,000 to 7,000 cases in Nebraska, just not know it because we're not doing enough testing. Same with the United States, we could have 4 to 9 million, not just the 560,000 that have been positive so far because of lack of available testing. That's probably the biggest mistake we made in the United States, was not having adequate testing soon enough. The other thing is to get forward, okay, what are we going to do next? One is to not repeat the mistakes of the past, and so there's actually very good histories of what happened in Nebraska where we made mistakes. We lifted statewide bans for political reasons. Some businesses forced people to open too soon, and we're seeing some of the same things potentially happening in Nebraska. One of the biggest worries I have, and I think the reason for why Grand Island is a hot spot, is that they kept the JBS and New Holland plants and everything still open despite having new cases. That spread everything around. Similar thing, our next closest hot spot is Sioux Falls, which had over 300 employees test positive again. It was a meat packing plant, and so they're kind of essential, but not necessarily that essential. I mean, we're going to be just fine if we go 2 weeks without a hamburger, but unfortunately they were late in closing these companies. And so this spread things around Grand Island and that general area, and so I think that's one of the reasons we have a hot spot in that area. And the other frustration is just the lack of communication still. Local physicians shouldn't have to write op-eds in the paper to get the state's attention, and this is what was happening in the last week or two. You had Sean John Jobst here in Lincoln, and you had doctors Libby Crockett and Rebecca Steinke writing in Grand Island trying to get attention, and so we need better communication than what we've got right now. The other thing to look at is, again, looking at past projections. One thing that I keep getting questions on, I keep hearing projections all the way from 60,000 to 2 million. What's going on here? Well, the problem is it partly depends that the projections are based on really wide-ranging variables that have a lot to do with how well our politicians respond, how good we do with social distancing, and what the true case fatality rate is. All three things we cannot fully predict. So will our infection rate be 3 to 5%? I think it'll probably be higher than that. Hopefully it won't be as bad as 30% or an out of control rate of 70%. So probably our range is going to be in this range. However, that there are some concerning signs about case fatality rates maybe being higher than originally thought because of the delays in between infection and death. So let's say if we don't do a good job with our physical distancing, we end up getting a 30% infection rate, and our case mortality rate ends up being 1%. We could be talking 1,000 deaths in Lincoln and 6,000 in Nebraska. So we are not in the clear, and we need to not be complacent. We need to try to skew toward this end as best we can, but that means people following directions. One of the things I think we need to consider is potentially an intercity travel ban. Unfortunately, I was very disappointed this weekend over Easter seeing that there are a number of people who seem to have a lot of cars in their driveways, which meant people were coming over to visit for Easter. So hopefully that didn't spread things around again some more. We do know what the national roadmap should be. Unfortunately, it's being written by former administration officials, not current administration officials. I think Anthony Fauci was correct, though, over the weekend, where he said, if we're lucky, we'll be opening up in May, and he's hoping that we'll be ready to back to normal by the November election. Again, it's all dependent on how well we do. We do know from Tom Frieden's map, and again, this fits with what happened during the influenza epidemic of 1918. There were actually 3 different waves. So right now we are in this phase. We're in the ramp-up phase. We don't know where it's going to peak out because we can't test, and so we're still flying blind yet. Once we get enough testing, then we can see, okay, are we going to peak out and we're going to start dropping? And then if we've been dropping for several weeks, then we can talk about opening back up again. I think best case scenario is that's middle to late May. But that, again, it depends on everybody getting things right from a political perspective and a testing perspective, and it's too early to guess whether either of those is going to happen. The other thing I'm concerned about is I think we need to have that intercity travel ban. So we have a huge hotspot right here. We got another one up north of us. Are people still driving all around back and forth? Unfortunately, over Easter weekend, I think people weren't listening and were driving back and forth to visit families and had big Easter egg hunts potentially. Any of that driving back and forth is going to spread things around even more and delay our time. If we want to watch Nebraska Husker football, people are got to start paying attention. So when we can open up, one, we have to have adequate testing. We still don't have that yet. After that, then we can see 14 days of reduction. Hopefully our hospitals are stocked and ready to go. And then before we can open, we need to have a good coordinated approach involving public health, our primary care doctors, and potentially even our schools if we're going to open up this fall. That hasn't even started happening yet. So hopefully we can get that group starting to meet here in the next few weeks and start planning this out. I'm managing one of those primary care networks and nobody's contacted us yet. So obviously that planning is not happening. And then back to you again. So coronavirus spread is right now is almost wholly dependent on you because we can't do some of the other things because of our lack of testing and some other stuff. Hopefully got some political decisions right, but until then you need to do your job. And so the questions I get, one is I wish people would focus less and less on the theoretical and unproven and focus on the simple and effective. So I see things like this, somebody modeling droplets spreading through the air like this. This is so theoretical, I would not freak out about this at all. The chloroquine stuff is overblown. There was UNMC faculty went through and looked at the original French study. It was full of holes. And so don't quit wasting your time arguing about this stuff. Focus on the stuff we know that works. Maintaining that physical distance. Coronavirus is not spread like measles, where it's literally an airborne virus. If you walk into a room with measles, almost everybody's going to get exposed. This is primarily hand spread and droplet. Droplet, like I say, droplets drop. And so it's 3 to 6 feet in an enclosed space, and it's probably even better in an outdoor space. So this is very unlikely, I think, from coronavirus. So physical distance, 3 to 6 feet. Wash your hands. The biggest thing is spread is in our hands, not in the air anyway. It's the common objects that you're touching with your hands. That's the problem. And the reason you want to wear a mask in public and high contact spaces is mainly to keep you from touching your face because it's on your hands that things are going to get spread. And then if you happen to have it and cough, most of it would get caught in your mask. So you're wearing the mask not to protect you from others, but protect others from you. And so people are getting a little backwards there. And so again, from this New England Journal, chance of catching COVID-19 from a passing interaction with some distance is very minimal. Again, it's your hands that are the big deal. And so what I'm most worried about is actually things like this. And so the spread, if it's on your hands, then yes, you've got physical distance with the frisbee playing, but it's the frisbee that's the vector. So you touch the frisbee, they touch it, and just back and forth, back and forth. The frisbee is your main thing, not the open air. Same with volleyball. Maybe you can prevent some distancing, but you're going to be close to the net. And again, it's the volleyball that's the problem. And basketball is probably even worse because you're always up close and personal blocking out playing basketball. So you're going to get it that way. Plus, you're going to get it from the basketball. So this type of sports is not okay for right now. Outdoor activities, though, are okay, though. I don't think you need a mask if you're doing any of these things. If you're riding a bike, if you're walking the dog, if you're out there with neighbors in the park or garage or in your driveway, I think you're completely fine that way. As long as you're not touching it, anything in common, you should be good. I've even asked about golf. Well, I think golf could be done the right way, assuming nobody's pulling the flag and people aren't sharing the same golf cart. The only people who should be in the same golf cart are a husband and wife, basically. If everybody's just carrying their bag and walking and not touching the pin, it might be okay with golf, but you got to do it right. Lastly, I think I hope we don't have to get to a stay-at-home ban because I think it's good for us to get out and be active, just like being on the bike path, being out like this with our neighbors. Again, last weekend we did the same thing where we got together in a neighbor's driveway. We've got 6 feet squares. We keep each other distant. We bring our own chairs, our own cooler. Nothing gets touched in common. We have to walk back home to go to the bathroom, of course. But if we do it that way, I think it's safe, and we need to be able to have that social outlet. So hopefully that's helpful to you. We've been putting now, I've been asked, well, where are the old videos? If you go to healthylincoln.org, your website, all the old videos are on the main page.